Some German studies looking at homeopathy, particularly with obstetrics. They found that it was, one of the most commonly used therapies in obstetric units in Germany. The decision to use it was mainly made by midwives, sometimes doctors, and also patient demand. Remember when I said that homeopathy is quite well known in Germany? It was actually invented by a German doctor, so its tradition is very steep in that country. And also it was offered in 95.7% of departments, as a preventative or in problem situations, and a lot of the times in Germany it was administered by midwives. Other studies, particularly close to home, there was a South Australian study that showed that 66% of midwives recommended homeopathy compared to 7.4% of obstetricians. In North Carolina, greater than 30% recommended it. And in Israel, about 39% of midwives recommended it, 33% have recommended it in the past, and 38% use it. So it's got quite a high usage rate in obstetrics and midwifery. Cochrane did a review of 2 trials looking at homeopathy and placebo for cervical ripening and labour induction. It found that the mean length of labour was shorter in control groups in both studies, but they couldn't recommend it because the sample sizes were quite small and there was insufficient detail in some of the studies. So they identified a need for more rigorous trials, and that just highlights the problem that I explained before, was that a lot of the trials are small, there's not enough of them, they're insufficient, and sometimes they're not trialling homeopathic medicines using homeopathic principles. They're trialling homeopathy in a pharmaceutical way, where they're just using one remedy that's not exactly matching a person's symptoms. So therefore, that the results aren't as effective, like we know it is if somebody gets the remedy that matches their symptoms.